In this video, I'm going to talk about some of the Bunyavirises and some of the arenaviruses. Specifically, we're going to talk about the ones that tend to affect the CNS. So within the Bunyavirus family, we're actually going to focus on the California encephalitis group viruses, which is California encephalitis virus, Jamestown Canyon virus, and La Crosse virus. There are some other ones that we've already learned about, like Sin Nombre virus and Hantan virus, which tend to cause like a pulmonary syndrome or Korean hemorrhagic fever, which we're not going to talk about in this video, but there are videos for that on the YouTube, on my YouTube page if you want to learn more about those. For arenavirus, we're only going to talk about LCMV here. Lassa is the other arenavirus that we talk about, and again, there is a video for that, and you learned about Lassa in your Walter Peters case in host defense, host response. So let's start with the Bunyaviruses. So this is kind of a reiteration of what I was just talking about. So the California encephalitis virus group includes California encephalitis virus, Jamestown Canyon virus, and La Crosse virus. All of these are vector-borne. Not all Bunyaviruses are vector-borne. Specifically, Sin Nombre and Hantan are not. These are not arboviruses. They're actually spread by inhaling that dried rodent excrement that we talked about. But that kind of makes sense because their cousins up here that are spread by rodents, their reservoir, their host is rodents. Well, except for squirrels. But rabbits, squirrels, field mice, all of them. I actually find this really easy to remember that these encephalitis viruses are Bunyavirus, and let me explain why. I'm a mom. I have a child in preschool. Some of you may remember when you were children the famed child singer named Raffi. Raffi had this song, Little Bunny Foo Foo. My son loves this song. It goes, little bunny foo foo, hopping through the forest, scooping up the field mice and bopping them on the head. All right, so how does that relate to Bunyavirus? Bear with me now. So Bunyaviruses have a reservoir in field mice, and they cause encephalitis. So now we just changed the song. Little Bunyavirus hopping through the forest, scooping up the field mice and infecting their heads. Doesn't fit quite as much, but you kind of get the gist. Okay, so that's kind of the gist behind these. There are a lot of Bunyaviruses, over 200 enveloped, segmented, negative strand RNA viruses. Most of them are arboviruses, but not all of them. Okay, most of this I went over in the last slide. These are negative sense segmented RNA viruses. Most of them are arboviruses, not all, but all of the ones that we're talking about in this video are. So that's Jamestown Canyon, California, and La Crosse. They induce viremia, which makes sense because they're arboviruses. You can detect them by RT-PCR, and that's how you can identify that it was actually this. They have an Aedes mosquito vector, and they like to hang out in rodents. They're friends, the field mice. All right, so what do they actually cause? In almost all patients, you get this fever, headache, and then it can create this mild to severe CNS involvement that might include seizures. La Crosse virus tends to be the most common and unfortunately the most severe. La Crosse is actually endemic to this area. It was named because it was initially found in La Crosse, Wisconsin. And that actually leads to seizures in about 60% of cases and death in about 1%. In 2016, between 2007 and 2016, though, there were a significant amount of cases, that's kind of what this image shows, that resulted in neuroinvasive disease throughout the US. So you can see it's largely toward the eastern half of the US with a little bit on the other side of the Mississippi River from us. There is no treatment specifically other than supportive care, and there is no vaccine for any of these three. Okay, let's switch to the arenaviruses. So the arenaviruses are named this way because they have kind of a sandy appearance. So arena is apparently the Spanish word for sand. And this group has this pebbly or sandy appearance because there's actually ribosomes that are on the envelope. So once again, we're talking about an enveloped organism. It's a segmented RNA virus, single-stranded, sometimes considered a negative sense, sometimes ambisense, depending on the source you're looking at. We've talked about a lot of them already. So we talked about the South American hemorrhagic fever viruses, which are Junin and Machupo, which we talked about with Walter Peters, along with Lassa virus. Right now, we're going to focus on lymphocytic choriomeningitis virus, as that's obviously the one that might infect the CNS. Okay, so the name would suggest meningitis is the typical presentation of LCMV, but that's not actually true. Normally, LCMV just causes an undifferentiated fever and a febrile flu-like myalgia. Only about 10% of individuals will actually develop CNS symptoms. The meningeal illness, if it's going to occur, will start about 10 days after the initial symptoms. You'll see perivascular mononuclear infiltrates in the neurons of all sections of the brain and in the meninges of an affected patient. Most patients survive, and no chronic infection has been described in humans, although it is a significant model of chronic viral infection in mice. In general, mortality is less than 1%. So you're talking about kind of an aseptic meningitis. So hospitalization certainly, supportive therapy certainly, and you can use corticosteroids for severe circumstances of this. We're not going to talk about Lassa and Junin and Machupo today, but there are videos for that on my YouTube page if you want to find out more about them.